Hi guys, welcome to Body Fits Golf with me, Russ Jones. Today we're going to be looking at the spine, more specifically rotation of the spine, how we can improve your performance and reduce your chance of injury. So, let's get started. Okay, so spine rotation. Average on the PGA Tour is players will turn their hips 45 degrees and then turn their torso an additional 45 degrees on top. Simple maths, that gets me to 90 degrees, so I get a good shoulder turn. Now, for the amateur and club golfers who have jobs, we spend a lot of time over a desk or in a car, which can cause our mid-back, which is our thoracic spine, to get in a little bit more of a slumped or a rounded position. When it stays like that for a long time, it can get a little sticky around there. Therefore, I might not reach that 45-degree turn of torso. What the body will do to feel like I've wound up and loaded my backswing enough, feeling powerful, I'll cheat and tend to use my lumbar spine and my pelvis a bit extra. Now, twofold problems there. The more I go on the way back, the harder it's going to be for me to sequence my swing on the way down and get consistent strike. The other thing is, if I torque my lower back too much on the way back, the speed with which I go the opposite direction through the ball over time can cause a lot of pressure and a lot of pain in the facet joints of the lumbar spine, which many golfers all over the world have experienced that at one time or another. So here's a simple thing I can test to see, can I turn this mid-thoracic spine? With my leg at 90 degrees, I've eliminated the hip and the pelvis. I just take my club across my shoulders and see if I'm able to rotate effectively through that area. I could also do that on a chair where I'm sat down with the hips at 90 degrees, test right versus left. Film it yourself on your phone, then you can look back, see how much the club points to what angle you're rotating. For extra feedback, you could put two clubs down, gives you a 45-degree line. You're looking to beat that. Now, most people fail that test. Like I say, club golfers, pros tend to pass it quite regularly. Here's some things we can do to fix that. So I take my foam roller, I'm going to place it in my mid-back, so it's just below my shoulder blades. I'm going to try and keep my hips on the ground, support my head at all times, because I don't want to now do extra work with my neck. I want to try and get the range of motion through the mid-back. So I take a nice breath in, and then slowly lean back over the foam roller. So I'm opening up the spine, open up the rib cage, go to a point, only discomfort. Whenever we're doing any of these drills, we never want to experience pain. During exercise, stretching, we're always going to go to some point or another where we have discomfort. That is fine, that's change occurring. Pain, no good, you need to stop, book yourself in locally with someone that can check you out. So again, take a deep breath in, exhale. Now there's 12 discs in my thoracic spine. 12 vertebrae. So I can move up and down a little bit, staying over the rib cage, to see if I can find a spot that's a little tighter than the rest of it. So once I've searched up and down that area, I then want to add that rotation. After all, that's what we're here for. I'm going to take the foam roller, I'm going to place it between my knees to take a bit of pressure off my hips and make the stretch easier at first. If you suffer with a bit of neck tension, a small pillow or a rolled up towel under your head will help you here as well. My hips are back up to 90 degrees. That's going to eliminate the hips. Arms out in front. And then I'm just going to, as I exhale, open the stretch and try and turn my chest and see how close to the floor I can get on the other side. So as I go, my head naturally falls to the floor, or like I said, can stay on a pillow if it's more comfortable for you. Also with neck rotation, some of you when you turn your heads might go a little dizzy. I don't mind if you keep looking forwards the whole time and try and turn, because after all, in your backswing, your eyes will be fixed on the golf ball anyway. So personal preference as to whether you turn the head or not. I like somewhere between 5 or 10 repetitions. If that's getting easier, it should do over time, I can remove that foam roller. Now my knees are together, it's a little tougher stretch. Over I go. Once I'm getting pretty good at that, I like to add a little resistance. I'm going to fire up those back muscles a bit better. So I just take any resistance band is good. I hold one hand on the floor, pull the band, stretch. It's the same stretch, only now I'm activating the muscles a little bit more to get the job done. like so. Next, I'll go to a kneeling quadruped position. Again, I need to sit the hips back. That's going to, again, help lumbar spine get locked, make the hip lock so I don't use them. Remember, that's what we're trying to do, not use that area as much. I'm then going to place my right hand behind my lower back. That just eliminates the shoulder. And again, as I exhale, turn and come back. Now, what's important here, one of the dreaded moves within the golf swing, we see sway and slide, lateral movement to compensate a lack of rotation or hide it. So when I'm doing this stretch, you again use your phone or use a mirror or use a friend. As I turn, I don't want to cheat and lean over. That feels like I've turned a long way, but all I've done is shift my weight over. So try and stay fairly centered and just pull that shoulder back like so. You'll notice that's a lot more difficult. It's going up against gravity on that one, whereas down on the floor, gravity's helping me. Next, I want to add a little bit of balance. So I'm going to bring myself back to that kneeling position. All right, so I'm going to add the resistance band in. First, let's see if I can stabilize these hips. I'm going to have arms in front, same test. Open the book, follow with the eyes, or again, stay looking forwards and have a big stretch. Once that feels good, add some more resistance. And feel that work in the upper back, back of the shoulders, the whole time really strict about what this leg's doing. Some of you might tend to have a little bit of shaking Stevens going on and go with the turn. Quite often I'll see this. Turn to the right, leg goes. That's me trying to cheat and use the hip and the lower back again. Keep that knee pointing straight ahead if you can. Another good drill I like in this position, now remember we're going to do both sides, is to get more stretch. If I add two factors in, like rotation and side bend, it's going to make the drill harder. Remove one of them again, and I can see more range of motion. What I mean by that, and I'll use the club here just to show you how much I turn. So I take an initial rotation to the right, once I've loosened up. I like a breath just to make sure I'm comfortable. And I'm getting an idea in my brain that my sternum, where it's pointing in the distance. So from there, I add side bend. Same as in my golf swing. I'm going to be side bending left whilst turning to the right. I stay there for a breath. I come gently back up. Take a deep breath in. Exhale, turn. And you can probably see there that club's gone a little bit further. Yeah, so both sides, same again. Make sure that knee's still. Turn as far as you can. Make sure you've got an idea about where your sternum's pointing. Add that side bend in. Hold. I like a breath to make sure that I'm under control and not wobbling. Come back up. Take a deep breath in. And turn. I can feel I'm a little bit tighter on that side. Last thing I'm going to do, put it in towards the golf fields. Something you can do at the driving range or on the golf course. Split my stance, and I like this as a bit of a warm-up too. Put the club back across my chest. I'm loaded through my forward leg, which in this instance is my right leg to focus on my backswing. And then I'm just going to practice turning my torso like so. Now if I try and sway here, I'm going to lose balance and fall. So you're going to feel how the muscles in your leg resist, particularly your adductors, muscles on the inside of the thigh, and feel the foot. The foot's an important bit. Get used to gripping the floor, stabilize that foot, stabilize the knee, and turn into it. For an exercise, if you get really good at that and want to challenge yourself, remove the back foot. So I'm now loaded on this leg a bit more and practice turning. There you go. Okay, some exercises there, hopefully help you move that spine better for your golf swing, help the lower back out, and help you swing hard and stay healthy. See you in the next video.